In this video, I will guide you through the step-by-step process of synopsis writing. Now here, the guidelines given are based on a RCT, that is a randomized clinical trial. But if you are doing a cross-sectional study, you can also follow this as a lot of the things are similar. So hello everyone, my name is Shanglap Kundu and currently I am doing my Masters in Physiotherapy in Neurology from NILD, Kolkata. Now, before going into the video, let's talk about some basic rules of synopsis writing. First thing is that you need to follow a total page number. So you need to finish your synopsis within 50 to 60 pages, including the annexures and the pictures and everything. The second thing is that you need to follow a proper page size, margin, and alignment. So generally we take A4 page size and we keep a space of 2.5 centimeters in top, bottom, and right direction. But we keep a space of 3.5 centimeter in the left direction, mainly for binding purposes. And we keep the alignment as justified. So after selecting all the content, you can just press Ctrl and J, or you can just click on this button to get your writing in a justified alignment. The third thing is that you need to follow the proper binding rules. So generally, your university or colleges prefer hard bindings over any spiral binding. The next thing is that you need to know the number of copies that you need to prepare for your submission. So generally, we need to print 4 or 5 copies of our synopsis, and 1 or 2 of this we need to submit to the university, and the rest of the copies we need to submit to our college. One in the academics, one in the library, and one to the guide, and so on. Right. The next thing is that you need to follow a proper font style. So for font style, we generally prefer the Times New Roman. The next thing is that you need to follow a proper font size. So generally, we keep 16 font size for headings, 14 font size for subheadings, and 12 font size for the rest of the content. The next thing is that you need to follow a proper referencing style. So we need to follow a proper referencing style whenever we are writing our synopsis and whenever we are giving the references, right? So I have talked about this referencing method at the end of the video. So please make sure you see the video till the end. Now the contents of your synopsis. So your synopsis needs to be based on these following points. First, it needs to have an introduction, then the purpose of the study, then the aim and objectives, then review of literatures, then materials and methods, then intervention, then statistical analysis, then references, and finally the annexures. So you need to make these points in your synopsis, but remember you can add or remove the points on the basis of your university or college guidelines. Okay, so the first part of writing a synopsis is you need to write an introduction. So it is important because it will give the reader a brief idea about your research. Now, it should be short. Generally, 2 to 3 pages are enough to write an introduction. Now, there is no specific rules to write an introduction, but generally it covers first is your definition of the topic, including your target population. Now, suppose you're doing a research on lateral epicondylitis or tennis elbow. So in the first part, you need to write what is tennis elbow, what is the prevalence, right? If there is any demographic data and so on. Now, in the second part, you need to write about some pathophysiology. That is what happens in that disease. You can also mention anatomy part if it is needed to. So if my topic is tennis elbow, we need to find out what is the pathophysiology behind that disease. You can also give some recent advancement of that pathophysiology if there is any, or else whatever you can find from the books, that will be sufficient. But don't forget to give the reference. Now, in the third part, you need to write what are the available approaches for treatment of your chosen topic, right? That means how you can treat lateral epicondylitis. So there are many options and you need to write those options giving proper evidence. Now, in the next part, you need to mention the approaches that you are choosing and why you are choosing it. You need to give some evidence. Now, suppose I am taking two modalities, right? Like laser therapy and on the other hand, extracorporeal shockwave therapy. So these two approaches that I am taking to give treatment to the lateral epicondylitis patient. So I need to give some explanation why I am taking it, and I need to provide evidence in favor of that. Now, in the next part, we need to write about the outcome measures in brief, right? Outcome measure means whatever I am going to treat the patient, I need to check if it is really effective or not. So to check that, the best option is to take some outcome measure. So suppose I am checking the pain with NPRS or VAS, right? So I need to mention about those outcome measure, right? The pain outcome measure, and also we need to give the ICC score. Now, generally, NPRS and VAS are a good, reliable, and valid scale, but you also need to search some article where it shows that NPRS and VAS are reliable and valid in this population to measure pain. So there are different various studies on that. You need to find it on different search engines. Now, in the last part, you need to write down what are the gap in the research and your aim of performing the study in very brief, just 2 or 3 sentences, right? So for gap in the research, when you are searching for different articles, somewhere in the limitations part of those articles, you can find that they said that this is a gap in the research and future research should be directed in that direction, right? So if you got that part, that's fair enough. Or if you don't find that, that's also okay. You just need to say that I am going to compare between these two, right? Like here, I'm comparing between laser therapy and extracorporeal shockwave therapy, and I need to check which is a better option, right? And the aim of performing the study will also similar, right? Why you are doing the study, you just need to mention it in a sentence. So that goes your introduction part. Now, in the second part, you need to mention the purpose of the study. It gives the idea about why you are performing the study, and it should be written within a page. Now, you can write it like, suppose I am checking superiority of Y drug or Y therapy over X drug or X therapy, as Y drug is new or Y therapy is new and it is cheaper. So how to write that? So we need to write that there are studies available where X therapy or X drug significantly improves H function in Z population. Y therapy or Y drug has also shown to improve H function in Z population, but maybe there are less studies available. But there are no studies available comparing between these two therapies or drugs. So the purpose of our study is to find out the efficacy of X therapy or X drug over Y therapy or Y drug on H function in Z population, right? In the third part, you can write about the aim and objectives. So you can either include it under purpose of the study or you can make it as a separate entity. So in aim, you can write to find out the efficacy of Y therapy over X therapy on H function. In the objectives part, you can write to find out the efficacy of X therapy on H function in Z population, to find out the efficacy of Y therapy on H function in Z population, and to compare between the efficacy of Y therapy over X therapy on H function in Z population. This is one of the most important part of your synopsis writing, that is your hypothesis. Now, you need to write your hypothesis according to your study, like if it's a superiority trial or a non-inferiority trial or an equivalence trial. Now, in my previous example, if I'm assuming that Y therapy is superior over X therapy, then I'm doing a superiority trial. But if I'm assuming that Y therapy is not inferior to X therapy, then the trial is a non-inferiority trial. But when I'm assuming that Y therapy is equivalent to X therapy, then I'm performing an equivalence trial. Now, there could be errors if we perform a wrong hypothesis testing. The errors are type 1 and type 2 error. So if you guys comment about this, I will definitely make a video on type 1 and type 2 error. But please make sure you cannot make that mistake of doing an error. So be aware of it. So generally we write two parts here. First is the null hypothesis or H0, that is the observed difference between the groups are by chance and not statistically significant. And the second part we write is the alternative hypothesis, or H1. Here, the observed difference are real and not by chance. That means the changes are statistically significant. So to write the hypothesis, first we need to mention the null hypothesis. In this part, you need to write that there is no statistically significant difference between the efficacy of Y therapy over X therapy on H function in Z population. And for the alternative hypothesis, you need to write that there is statistically significant difference between the efficacy of Y therapy over X therapy on H function in Z population. Now, the most boring part of your synopsis, that is the review of literatures. But remember, it also shows your hard work. Here, you need to write all the research papers or articles that you have reviewed for your study, which needs to be relevant as per your study. Now, suppose you are doing a clinical trial on lateral epicondylitis patient. So, when you are writing the review of literatures, it should be based on that topic, not a review of literature on ankle sprain, right? Now, generally, you need to write at least 20 ROLs, but please consult with your guide and see the guidelines in your university or colleges. So the more review of literatures you give, it shows that you have done a very hard work for your synopsis presentation. It is most likely that you need to write ROLs in Vancouver method. So you also need to know how to write your ROLs in Vancouver method. In ROL, a small tip that don't forget to mention the reliability and validity of the outcome measures that you have taken in your study. At least mention one for each outcome measure. Now, suppose I have taken VAS for pain outcome measure. So at least I need to make one review of literature where I can show that VAS is an effective tool to measure pain in lateral epicondylitis patient and also give the ICC score. Don't forget that. Okay. Here is an example of ROL in Vancouver method. So first you need to write the title of the author and then you need to write it all. You need to give stop only after all, and after that you need to give a space, and within bracket you need to give the publication year of that article. Then you say whatever the author is trying to say in that article. And after finishing that, you also need to provide the reference within third bracket in a superscript form. Now, the core of your synopsis is the material and method. It includes the study design. Now here, as I'm talking about an RCT, so you can write that it is a randomized clinical trial, or if you're doing a cross-sectional study, you can also mention in the study design part. Then the place of the study, that is the place where the study is taking place. Now, if it is a multi-center study, you also need to mention the other sites where the study is taking place. In the third point, you need to mention the period of the study, that is the duration of the clinical trial. For example, if the trial is going from December 2023 to January 2025, you need to mention that. Then the study population or the target population of your study, as an example, patients with multiple sclerosis. The sample size, so the total subjects or patient you have planned to take. Generally, when we are doing a RCT, the minimum number of patients we take is 30, but here you can perform a pre-priori power analysis of your study, which will make your study a good study because there is a less chance of being the type 2 error to happen, and take the sample size according to your power. Next, you need to mention the source of the sample, that is from where you are taking the patients. As an example, as I am doing the study, I can write that patient referred from the assessment clinic of NILD, that is my institute, to the Department of Physiotherapy, having diagnosed with multiple sclerosis. Now you can write according to your institution and college. Now after that, you need to mention the sampling design. That is how you are going to choose the sample. So it can be a convenient sampling or it can be a block randomization technique using computer software, etc. For block randomization technique, I have already made a video on that. Click on the I button to check that. Now the next part in the material and methods is the inclusion criteria that describes the primary traits of the target and accessible populations that will make someone eligible to be a participant in your study. These mainly consist of clinical findings, which includes diabetes mellitus, hypertension, stroke, etc. Then the demographics, which includes age, sex, height, etc. Then the geographic factors, then any cutoff score on any surveys, questionnaire, depending on your study. And finally, any other important factors to the question being asked in the study. So after including the patients, you also need to exclude the other patients. So that will come under your exclusion criteria, which describes the factors that would preclude someone from being a subject in your study. These factors will generally be considered potentially confounding to the results and are likely to interfere with interpretation to the findings. So we need to exclude those patients for the betterment of the study. Exclusion criteria for RCT are often extensive, eliminating patients with comorbidities and other various demographic or health traits that could confound examination of relationships among study variables. So let me show you an example of inclusion and exclusion criteria from a study. So for this, I have chosen this study where they are checking the efficacy of DNS on balance, trunk function, falling, and spasticity in multiple sclerosis, which is a target population. It is a randomized controlled trial or a RCT. Now here the inclusion criteria shows that the patient has to have a MMSE score greater than 21. Patient is able to work. Patient might have a fall within previous 3 months and at least a high school diploma to complete a self-report questionnaire, which is relevant to the study. Now for exclusion criteria, the people with multiple sclerosis with other neurological disorder, they will be excluded. Exacerbation of multiple sclerosis during last month, they will also be excluded. Patients with apraxia, severe spasticity, major surgeries in lower extremities, postural abnormalities in spine, and any other cardiovascular disease, they are also being excluded from the study. Now, this exclusion criteria is very much needed to have a focus on the inclusion criteria, the including patients, and our main aim and purpose of the study for being fulfilled. Next in the material and methods are the study variables, which includes first is the independent variable, which is the cause. Now its value is independent of other variables in the study. Here we need to mention the therapy or drugs that we are giving to the patients. Second is the dependent variable. It is the effect of the independent variable. Its value is dependent on the changes in the independent variable. Here we need to mention the outcome measures that we are taking in our study. So next in the material and methods are the study tools, which includes questionnaire, rating scale, attitude scale, test, etc. Generally, we write study tools under 2 points. First is the instrumental tools, that is the tools or any hard equipment that we need to perform our study. It could be any mechanical or electronical devices, any drugs, etc. The second is the physical tools, which includes patient information sheet, consent form, evaluation performer, data collection sheet, outcome measure scales, if there is any, and also any other things required for the study. That is a chart for home exercise program and so on. Now, next in the material and methods are the procedure. So first, you need to write the procedure in descriptive format. Remember, procedure is like a mind map that you have created for your research. It should be in descriptive format and also in a flowchart. So for the first part, you need to write it in a descriptive format where you need to mention all the points in proper sentences. So first, like the patient diagnosed with X disease referred from assessment clinic of X center to the X department or Y department and will be approached with the study. Second, then patients with Z population will be taken for the study after proper assessment and screening as per inclusion and exclusion criteria. Then informed consent form will be taken from those patients. Then we do a proper randomization of those patients. After that, we will take the outcome measure scale at day 0, that is before performing any intervention to the patient. And then we will give management to the patient. And after that, after the management is finished, we will again take a outcome measure at the final day after the intervention, right? Now you need to write the procedure again in a flowchart format, the same that I have mentioned previously. So here, whatever you have written, you need to write that in a flowchart for better understanding of the reader. Generally, we follow the consort flow diagram. So here is the diagram, and I have given a picture of the diagram for your better understanding. So this is the consort 2010 flow diagram with me. It has 4 parts: enrollment, allocation, follow-up, and analysis. In the enrollment part, you just need to mention how you are assessing the patients and how you're doing the randomization process. So for synopsis, remember, you have not taken any patients yet, so you need not to write any n values over here. Now, for allocation part, you just need to mention in which group you are giving what intervention. Just mention that and also mention the outcome measures that you are performing to the patients. Now, if you don't have a follow-up in your study, don't worry, you need to write nothing in this part. And the most important part is analysis. So just write here that after the data collection, analysis or statistical analysis will be done using a statistical software, or you can just mention the software like IBM, SPSS, etc. If you know the software, just mention that. Remember, you can modify this as per your guide and the college guidelines. So please ask them how to do that. Now, next in material and methods, the outcome measures. So here you need to describe all the outcome measures that you have taken in your study. If it's a scale, then don't forget to write its properties in short. Also, don't forget to write the ICC value as I mentioned earlier, and also mention the reliability and validity of that scale. Write the interpretation of the scoring if it's possible, right? Like good, fair, poor, etc., depending on the scale. If it's a device, then try to write its validity and reliability with respect to a gold standard measure for that particular trait that you are measuring. Lastly, you need to mention at what timeline you are going to use the outcome measure. Now, the next most important part of your synopsis is the intervention. So here you need to mention all the treatment protocols for different groups as per your study. If you are using a modality for your treatment, then you must need to mention the position of the patient, the position of the therapist, how to operate the machine, and so on. Don't forget to write the dosage, be it a therapy, be it a drug, be it a machine, whatever it is, you need to mention the dosage. It is very important that you do that. Try to give references if possible in the interventions, right? If you are doing intervention that has already done in some other patients and you are taking that intervention for your research, then please give the references. You need to give diagrams for better understanding. So take photographs properly with a model which you need to replace with proper patient at the time of dissertation submission and article publication. So this is a very important part that whatever you are doing, you need to photograph those activity. So it is advised that you take photograph in a proper place with proper background and the photo clearly depicts what intervention you are giving the patient. So the next part is the statistical analysis where you need to mention how you are going to analyze your data. If you are not sure about the software you are going to use or the statistical test you are going to perform, then you can simply write that after completion of data collection, data will be summarized first, data will be analyzed then by using appropriate statistical tests. Statistical software will be used to analyze the data. But if you have a foresight how to analyze your data, which software to use, and what tests you are going to use, then you can write that accordingly. Always talk to your guide regarding this. Read different biostatistics book, research methodology books before performing the tests. Now for statistical analysis, most of us use the IBM SPSS software, but it is a paid one. Other free softwares include Jamovi, Jasper, R, etc. Out of this, I have used Jamovi, which is very much similar to the user interface like IBM SPSS. So you can use that. It is completely free. But here in this video, who have listened to me till the end, I have a trick so that you can use current version of IBM SPSS software for free. So listen to me carefully. Whenever you're downloading the IBM SPSS software from the official IBM SPSS website, they give you a 1 month free trial for using the product. So whenever you have collected all the data and you are sure that you are not going to take any more patients, you are certain about the statistical test you are going to perform, then only download that software from the internet to your PC where you have never downloaded the software before, because once you have downloaded the software and once you have used the trial period, trust me, you are never going to use that software for free again in that laptop. So be very careful about that. So for those who want to use the SPSS software for a prolonged period of time, you can use the SPSS 25.0 software with crack. It is easily available on the internet. I have taken that link and created a QR code. So just scan the QR code and it will redirect you to the software link. Now it's time for references. It's again a very boring part, but it's the part of the job that you have to do. There are different methods of writing a reference, and the most common used method is the Vancouver method. It is very important that you write your references in proper order and with proper numbering. If this video gets 50 likes, then I will make a video on Vancouver referencing style. So please like, share, and subscribe. Now, the last part of the synopsis is the annexures. So here you just need to attach the following things for reference purpose, and also you can use it when you take a patient's data. So it includes patient information sheet, informed consent form in different languages, evaluation pro forma, data collection sheets, scales for inclusion and exclusion criteria, if there is any, outcome measure scales, if any, and others like charts to follow, etc. Now, I have registered my trial in CTRI, that is Clinical Trials Registry of India. If you want to know more about my research that is going on right now, you can go to this website, that is ctri.nic.in, and you can search my research by giving this CTRI number. Remember, it is a public forum, so you can check anyone's research that is happening right now. So if you are interested, you can go to this website and check my research so that you will have an idea how to write things properly. So in the next video, I will show you how to register your trial in a clinical registry. Now, in summary, I will give you some tips. First, if you are writing synopsis for the first time, then please don't worry. It is not that difficult. If I can do it, you also can do it. So don't panic. Remember, it's a part of your curriculum, so you have to do it. No backsies. Okay? Ask for help from your seniors, your guides, other batchmates, anyone. They will definitely help you. Okay? So before starting, make sure you have a proper study plan figured out. आपका अगर स्टडी प्लान ठीक से फिगर आउट हो गया है, आप प्रोसीड्यूर को पहले लिख लो. अगर वो कर लोगे ना, तो आपका पूरा क्लियर आइडिया हो जाएगा आपको आपके रिसर्च में क्या क्या करना है. ठीक है. देन राइट द आरओएल्स विथ टाइम. रिव्यू ऑफ लिटरेचर लिखने के लिए आपके पास बहुत टाइम. जैसे जैसे आप रिसर्च पेपर्स आर्टिकल देखते जाएंगे, पबमेड में मान लीजिए, गूगल स्कॉलर पे मान लीजिए, पेड्रो में मान लीजिए, कहीं पे भी आप देख लो. You can add or remove those ROLs until it is not going to the ethical committee for approval. जब तक ethical committee के पास नहीं जाता है, आप इसमें add और remove कर सकते हैं. So take your time with ROLs. उसमें हड़बड़ी मत कीजिए. पहले क्या क्या खत्म करना है, पहले पर्पस ऑफ द स्टडी लिख लो, एम एंड ऑब्जेक्टिव्स लिख लो, हाइपोथेसिस लिख लो, मटेरियल मेथड जितना हो सके खत्म कर लो, ये इंटरवेंशन पार्ट को खत्म कर लो. ये सब जितने जैसे करने लगोगे, आपके अंदर एक कॉन्फिडेंस डेवलप होगा. जैसे वो कॉन्फिडेंस डेवलप होगा, धीरे धीरे आप बाकी काम को भी बहुत आसानी से कर सकते हैं. ठीक है. इंट्रोडक्शन लिखना, मान लीजिए कोई ऐसा बड़ी बात नहीं है, लेकिन मेरा सजेशन यही रहेगा आपको कि इंट्रोडक्शन पार्ट को आप लास्ट में करिए, क्योंकि इट विल टेक सम टाइम टू मेक अ गुड इंट्रोडक्शन. क्योंकि आप जितना आर्टिकल्स पढ़ेंगे, उसका जितना इंट्रोडक्शन आप देखेंगे, धीरे धीरे आपका इंट्रोडक्शन उतना पॉलिश होता जाएगा. सो पहले हर बार में इंट्रोडक्शन मत स्टार्ट कीजिए. टेक योर टाइम, आराम से आप इंट्रोडक्शन को स्टडी करते हुए खत्म कीजिए. ठीक है. So these are some tips. If you can follow, I think it will be helpful for you. So thank you everyone for watching this video till the end. If you want to know anything about write your synopsis, how to write your synopsis, अगर आप भटक रहे हो, प्लीज आप कमेंट में बताओ. आप मुझे डिफरेंट सोशल मीडिया चैनल्स में आप मुझे फॉलो कर सकते हो. ठीक है. मैं इंस्टाग्राम पे हूँ, टेलीग्राम पे हूँ. ठीक है. यूट्यूब में तो मैं हूँ ही. तो आप मुझे इंस्टाग्राम पे कहीं भी आप एक टेक्स्ट डाल दीजिए. जब भी मुझे टाइम मिले मैं आपको रिप्लाई करूंगा. यूट्यूब में आप कमेंट सेक्शन में भी डाल सकते हैं. जब आपको टाइम मिले आप डाल दो. मेरा जब टाइम मुझे होगा मैं उसका रिप्लाई कर दूंगा. ठीक है. आज के लिए बस इतना ही. नेक्स्ट वीडियो में मिलता है. धन्यवाद.